I've been in practice for 12 years. Before that, 4 years of residency, and then I guess 4 years of medical school before that. Grew up in Minneapolis, but I went to Madison and then met a girl from Elm Grove. It's my wife. We have 4 kids together, so I figured we'd probably stick around here. I was going to be a writer, actually, and this seemed like a way that we would, all these writing courses in college, they talked about how to make the world a better place. No one actually did anything. So here's a way that I could do something kind of tangible every day to make things a little bit better. At the obstetrical visits, we see people a lot in pregnancy, especially towards the end, and the anxiety that's there. I have 4 children. I know the anxiety that's there about, is the baby okay? For my wife, are things to go through? Am I going to be okay in labor? Those are concerns, but also kind of the nuts and bolts of what are my options for pain control? What are my options for who's going to take care of the baby after the baby's born, and so forth. By definition, kind of when you go through those things carefully with someone towards the end of pregnancy, I think they understand that that we kind of care about not just how the baby's doing and what happens in the pregnancy and labor, but kind of afterwards too. How I feel on the inside is a little bit different than how we practice. I think on the inside, I'm a much more cautious person. I think I'm a much more conservative medically person than it perhaps comes across. I think to look at me, you wouldn't know I'm thinking about any medical things, because it's a wonderful thing, it's a natural thing, and we're really not looking for problems most of the time. But frankly, in the back of our mind, we think about some of the things that can happen that are a problem, and so we really want to do is set up ways that if there is a difficulty that comes up while someone's in labor, although we're set up to take care of it, the woman having the baby and the family certainly doesn't know that there's things, say, behind the pictures that are oxygen or ways to do a cesarean section quickly, because frankly, we don't need that often. In our minds, we're looking for signs that might be that rare time that something needs to be done that's different than a normal, regular vaginal delivery. Meadowview OB/GYN is a practice of 5 board-certified OB/GYNs. As we come out into training, you have to practice for a couple years before you can become board certified. We all have the same view on the things that we think are the most important about how you take care of moms and babies and things that come up from a gynecologic point of view. We do things exactly the same. I think our personalities are a little bit different, which is kind of a nice thing, because some people would prefer one type of doctor, some people prefer another type of doctor. Columbia Center is a freestanding birthing center. It's very comforting to me that it's attached to a large hospital that gives us access to all the technology that's necessary to a hospital, all the emergency services that are necessary to a hospital, but frankly not used for any delivery that I can remember over the past few years. Usually people come in, they have their baby, and it's safe. It's kind of comforting for me to know that although we are kind of separate and freestanding and able to make changes rather quickly, not like a big hospital, we're physically attached to a big hospital, so if we need those services, they're right there for us. I like to camp. I have a farm in Fredonia, so I like to grow stuff I have a big garden out there. And then having 4 kids is kind of my hobby. So whatever they're into, like lacrosse and tennis and swimming and whatever they tell me next, that's what I'm into.